because I have a husband who has a pre-existing condition, and I have a son with Crohn's disease. And what I discovered through my journey was that I needed to navigate the healthcare system. My background is I have an electrical engineering degree, and I worked for GE for almost 20 years, and I have an MBA. And part of my background was working on aircraft engines. As we worked on aircraft engines and designed all new parts for them, we were very careful to make sure that any change we made didn't cause the plane to crash, right? So I used to lose sleep over now what I look like is nothing. When my son got sick and he was hospitalized, I had nothing to do. I'm not a person that does well with nothing to do. And what ended up happening is I started to observe just a couple of things in the hospital that I said, we wouldn't do it this way. And I didn't know, I didn't tell anyone. I had full trust in the healthcare system. And 3 weeks later, after my son had his first operation, you know what happened? He was back in the hospital with an emergency surgery, and I saw a mother that, let's say, I saw the first day from the first operation, and I said hello to her, and I said, you must be back here, your son must be having like a routine checkup. And she said, oh no, Randy. She said he had a complication. And it was from the same doctor, the same surgery, the same time frame. Now, I learned quality in GE. I have what they call a black belt, and we would call that a defect. We would say that's not meeting, requirements. She came back and she said, I'm going to sue. That's it, I'm suing. You know what I came back and said? I'm writing a book. And so you know what's coming out this fall? My book, Questioning Protocol, and it goes through how I navigated the system. The reason I'm doing this now is you have to understand the rules and you have to know how to play the game. So the timing of my book, just by coincidence, comes out with the time of healthcare reform. No, one of the reasons I was successful in with new business development was I learned the importance of timing. So it works nicely. And so tonight what I'll be sharing with you are the rules of the Affordable Care Act. And I'm also going to give you some of the tips and the tools and the tricks that I use to navigate the system. And so, the first thing, how many people have heard something's been delayed? You heard? Okay, yes. So what has been delayed? Just it was the business mandate, right? So what happened was originally the businesses were going to have to provide health care. We're talking if you're over 50 full-time equivalent employees to their employees or pay penalties. That got shifted. But what didn't get shifted is our mandate. Did our mandate change? No. So what is our mandate? What does that mean? That means that January 1st, 2014, we all need to have health insurance that meets minimum essential benefits. How many people have heard this term, minimum essential benefits? Okay, I have a couple. So, how many people have gotten a letter from their insurance company saying that their policies meet minimum essential benefits? Yeah, see, and this is you're not alone, because I'm now from the state of Connecticut. This is my 5th presentation in 3 days, and I can actually say where we're at as a state. So the insurance companies were going to, this fall, be sending out letters saying, your policy meets minimum essential benefits, or here's what you need to get there. It's this fall, and that's the response I have. So the first thing we need to understand is what is minimum essential benefits? And what that is the federal government in the ACA, what they did is they came up with 10 buckets, and they said insurance products need to cover these 10 buckets. And in the buckets were things like emergency services, hospitalization, mental health, rehabilitative care, prescription drugs, and they just said, you have to have these pieces in it. But if you had a policy that paid out of every single thing, could you imagine how expensive that would be? that would be huge. So what the rule is that minimum essential benefits must meet, and this is the technical term, it must meet a 60% actuarial value. And so what was going on in the state of Connecticut is there are new products that have been designed that meet 60% minimum actuarial value and have these services in them, or a combination. So for us in the state of Connecticut, we typically, our state had already had very high mandates that insurance companies had to have. And so for our state, the delta between what we typically have and what minimum essential benefits are might not be that great. I just was speaking, can I share with the library that you found out that your policy does meet this? Okay, so here's an example. You know, you got an email today, not an accident, because I have to do this. She gets an email today and she says, oh, the library has just told us we meet minimum essential benefits. So what's the first question you need to know going forward? Does my policy meet minimum essential benefits? And you can ask that of your employer. You can ask that of the insurance company. I was told they would send you the letter, but I haven't seen, I mean, I do this. You see, the letter's not here. Things that are new. So if you're a 27-year-old male, guess what? He's going to have maternity coverage. Right. Okay. Things that are also new, pediatric services, including oral and vision care. So there might be some gaps, but that's the first thing. Does my policy meet this? So as I ventured into the land of learning about healthcare reform and also experiencing what I went through with my son, which was how do you keep him physically strong and also emotionally strong and deal with the fact that some of this didn't feel fair, I actually found a lecture called The Last Lecture from Randi Pausch, and I don't know if you, okay, 40 minutes, YouTube, if you want to find out the secrets of life. How do you handle the obstacles? How do you not just exist, but how do you live life? This man was a professor at Carnegie Mellon, and what he did is he lived life, and he was beloved. You know what? He got cancer. Like, he was in his 40s with little kids, and there he is. I have to now teach the secrets of life, and he does it in 40 minutes. And I walked out, and you should see my kids. We handle life very differently. You know, the example I give is I'm living my eulogy, not my resume. And I got that from, it was amazing. One of the tricks, or one of the things he says is, we can't change the cards we are dealt, just how we play the hand. Tonight, I'm going to tell you what the game is, what the rules are, and you're going to decide how you're going to play that hand. So why healthcare reform now? What was one of the driving forces? So I'm an engineer, I love Excel. I went in and I actually went to a government website which keeps the health data, compares all the countries, and it also then says as a percent of gross domestic product, how much do we spend compared to everyone else? And it compares Singapore, Italy, Australia, and the United States. And basically, here, and I hand inputted the data, and we won. We spend the most as a percent of GDP on healthcare. And Singapore comes in last. What does that mean? I use the analogy as if you close your eyes and say, I could buy the most expensive car, any car I want. You think of that car. Now go up a little bit, because we really spend a lot of money on healthcare. What would you want from that car? You want it to last. You want it to be easy to maintain. You'd want to be able to, you'd want it to work. So when they look at now how much we're spending, what are the results of that? And so you look at the mortality rate and our morbidity rate. And you know what happens? Our health rate, we come in 33rd, and Singapore comes in first. So what happened is that we're not getting the bang for our buck. It's not working. Their other statistics are it's not sustainable, that you just can't keep this up. And so why healthcare reform now? The system needs work. I experienced it in the hospital, but I didn't know that at the time. One of the things that's hard for me now, if I meet, let's say, a doctor, right, and this happens all the time, and I go, I think the system's broken, and I think I'm saying something shocking. You know what they say? We know. I'm like, how come you didn't tell me when my kid was in the hospital? I did not know. And so the Affordable Care Act basically says, how are we going to tackle this problem? And it attacks it from 3 vantage points. And this is the framework. So whenever you think Affordable Care Act, here's really what the act is tackling. The first piece you hear a lot about is access. So there's 30 to 50 million people that do not have health insurance. We need to make sure that they have access. And so there's quite a bit in the act to help get access. The second piece is cost. We need to reward doctors for improving quality and lowering costs. Here's our system today. If you go into the hospital, you come in and they say, we're going to take a CAT scan. Now we're going to do this, and then we're going to do that, and then we're going to do this, okay? How many people have seen a bill? Have you ever seen a bill from a hospital? Can you give an example of a cost that you saw that you said, what is that? Do you have any? Just on top of your head? Aspirin, okay, you see, right. So you'll see, the aspirin, you can buy 3 bottles of aspirin or whatever it is, and that's because our method is, it's called fee-for-service. Fee-for-service says every time I touch you, I am providing a service and I'm going to have a fee for that service. So we have to find a way to change our cost, right? And so how do we do that? Reward doctors for improving quality, reducing costs. And then the third piece is quality. How do we penalize poor performing hospitals, develop incentives for wellness? So that's the framework. Now I'm going to talk a little bit about how does it affect us. So here's my first example. How many people know someone or are on Medicare? Okay, perfect. So let me tell you how this works. First thing I also want to say, if you're on Medicare, guess what? You're okay. You're not going to need to go get any other insurance. So just know that. I'll repeat it again, but I want to make sure it's clear. But now you're on Medicare, and who knows someone on Medicare? Okay, so you have a loved one that's on Medicare, and maybe hurt their hip or needed a knee replacement, and you take them into the hospital, and they have the operation, and they're going to go for rehab afterwards. And here's how it works. The rules for Medicare are, you have to be in the hospital how many days? Oh, that's 3. This is, okay, this is important, right? It's 3. Make sure, I want you all to know, 3 days. And so you take your loved one to the hospital, the pumping machines are going, the nurses are coming in, the food is as yucky as can be. They're in the hospital. And they're in the hospital for like 4 or 5 days, and they get transferred to rehab. Now, Medicare says if you're in the hospital for 3 days, Medicare will pay the first 20 days 100%. Day 21 to day 100, you have a copay. It's like $150 or something. And then after day 100, how much does Medicare pay? 0. Okay, right. See, it's very important. Not everyone knows that. But yeah, I wish I had a gold star I would hand it. 0. Medicare pays nothing after 100 days. So here's what happens. Your loved one goes to rehabs there for 14 days, and 6 months later you get this bill for tens of thousands of dollars. And so you sit there and go, how can that be? I was in the hospital. I saw the nurse. I saw the machines. One of the things that's changing is how do we improve costs? How do we keep track of this? And so now what's happening is they're tracking readmissions within 30 days. So this is the question that you didn't ask, but now you'll always ask this question. You thought your loved one was in the hospital, and you thought they were admitted. Ah, you know what they were? They were being observed. Does observed count towards the days? No. So what do you need to do next time? Your loved one's in the hospital, they're on Medicare, standard Medicare. Many times the Medicare Advantage plans could be different, but standard Medicare, what do you need to ask the nurse? Is my loved one admitted or being observed? So now you do that. You go on Monday. And on Monday, no. Yes, we thought they were going to observe her, but we changed it to being admitted. You ask again on Tuesday? Yes. And you ask again on Wednesday, because they can change it. It's not your doctor who decides this. It is the hospital, and you need to ask. Okay? So here's my first, they started to say the law, and now you're getting some of the tips of how we can play the game, because it's important to understand that game. So what does affordable mean? It's affordable health care. Does anyone know? It says it right here. What's affordable? The definition of affordable is 9.5% of your family income. This is the business test. So businesses, as long as the insurance that they offer is less than 9.5% of their family income, it is deemed affordable. All right? One of the challenges is, does the business necessarily know what your spouse is making? Right. So again, my job tonight is to give you the information, and you're now starting to be aware. But that's in the back of your head. Just take that mental number, and you can now decide, is the insurance I'm getting through work considered affordable? Oh, and I will take questions, but at the end. And the reason that I do that is I've done this so many times. The feedback is take questions at the end so that we hear what you have to say. So I will answer your question, and many times I'll probably even answer it because I've heard it before. So I just don't lose it. All right. So how does health insurance work? So Connecticut is one of only 16 states that has decided to go in and take full responsibility for providing our health insurance and the exchange to the citizens. What does that mean? The state of Connecticut is building the marketplace. The marketplace is an online website where you can go and compare different insurances and purchase it. That also means that not only they design the insurance and work with the insurance companies, they have their own provider network, and then the call center is also manned through the state of Connecticut. When I started on this venture last January, I decided I wanted to go down to Washington to hear what's going on at the federal level, and I went to a conference for 4 days, and there were people from every state. And what I was amazed by is every time I said I was from Connecticut, this little state, they would say, oh, you guys are so far ahead of where we are, and traditionally, what we've seen through the last couple of months is Connecticut has continued to be ahead in terms of the development. The other states had some options. If they didn't go it alone, they could go into partnership with the federal government. The government could either provide the call center or help with the setting up the insurances, or the federal government actually said, we'll do everything. And there are 19 states that went federal government do everything. Today, I'm constantly reading. Do you know what just got postponed today? You'll see it because I just read it on one of the websites. The federal government states that have a shop marketplace for small business, they just moved from October 1st to November 1st. And it said, and the article I first read said just federal states, and they didn't give a reason why. I know in the state of Connecticut they've been working very, very hard, and there have been press releases which have said we've worked very, very, very hard, but it's still not going to be everything we dreamed it to be. There's the quote was 30% of the functionality is still will be developed later, but the core, it will work. It does everything it needs to do, but some of the pieces will be ongoing development. So if we had that trouble, we were so far ahead. I can only imagine, what these other states, are up against. But it's important as you're going to be reading the news on the national level to understand that Connecticut is a state-run facility, and we need as a state to come to our own conclusions about it. It's not necessarily what's happening with these other states. All right, so a small state, one of the reasons that Connecticut, I believe, needed to get involved and take some ownership was because when you looked at our health care spending, we come in 9th for the highest level of Medicare. We come in 4th for how much we're spending on our health care, and we win for how much we spend per enrollee on Medicaid. So there's a lot of money on the table. And I will say, after my years in GE, I learned many lessons. I survived many layoffs. I felt, oh my God, woo. But one of the things that I learned is if you have the opportunity to make a decision for your team, take ownership and do it. Don't give it away. And this is, most probably to me, I think, was a driver for how do we get our state and take control and see what we can do here. So healthcare, these are the, I call them the ivory tower numbers, which is healthcare is expensive in Connecticut. Here's why I'm here today. 2008, remember 2008? Anyone else have that happen to them? Well, it happened to my family like this. My husband loses his job. Boom. My husband might have a brain tumor. Boom. We have to go on COBRA. I have a kid with a pre-existing condition, and my husband, do you know how much COBRA costs? Yeah, I know you know. $1,800 a month, and he's out of work. $1,800 a month, and he's out of work, and now the operation was supposed to happen. COBRA ran out end of October. The doctor was going to take my husband in November. We're like, no, you have to do this in October. And I think the operation was like October 25th. We get him in, he gets better. A couple of months later, he lands a job, 50% salary, 100% benefits. All of our friends, you're worth more. You know what we said as a family? What can we cut? What can we cut? What can we cut? What we can cut? And you know what? He took the job. He took the job. We cut our expenses. 4 years later, they get taken over, right? Does the new company honor the fact that that job was supposed to give him 100% of the help? No. I won't even tell you. It's hundreds of dollars that they take out now. So I share the story. You know why? I'm not alone. It used to be hard for me. Now I know, because I've met so many people. Am I alone? You don't have to raise your hands because you might be embarrassed. But I can see by your smiles. This is what it is, and this is what the state, when they look at the numbers, this is how they see it. They see it as, macro. But, total premiums rose 96% in the last decade, and our incomes rose 13%. I'm like, okay, yeah, if you were lucky you had a 13% increase. But we feel this. And the others, this is all from the state of Connecticut, and the expenses for healthcare are rising 8.8 times faster than income. It's affecting all of us. And so they said, those are the statistics. So we need to first get the people who don't have health insurance, we need to make sure they get health insurance. That's the access. And in our state, there are 344,000 people who don't have health insurance. 100,000 of them will probably end up on Medicaid, and 244,000 will be transferred to the exchange. And they've done, to get out to them, the state has really ramped up and said, okay, we're going to set up a system where we're going to have navigators that are in charge of regions, and then they'll have assisters, and these people will speak 30 languages, they're going to take exams, they're going to learn all about insurance, and they're going to go out into the community. So how many people have you seen first of all, do you have an assister at the library? An assister. Because some of you might not have.
We don't have one. No, I know some of the larger libraries are getting them, but we don't have one. Yeah.
So they've got, how many people have seen an ad or any, advertisements about health? Have you heard anything, seen anything?
Just yesterday, I heard about the Access Health Connecticut website.
So where did you hear it?
On the news.
On the news.
I've never heard about it.
Okay, anyone, I just want to get a sense.
I've seen Access, they've had commercials.
So you've seen some commercials,
Yeah.
Okay, but I'm getting like 10% maybe, okay. So So they're out there trying to make awareness and trying to reach that you need to go on the website. So last March I called up the state of Connecticut and I said, terrific, focused attention, who's educating the 3.4 million other people in the state of Connecticut? And they said, can you? I was like, okay. I was like, oh. And literally, you know what? I was like, I'm going to do my best. And I called up the library, and they said, here's the secret. If you do a good job, the librarians talk, and the next thing you know is you get booked. I have over 60 requests for libraries. I had no idea that this was going to happen, but I'm happy to be here today to get you this information because it is the fall, and you know we're at about 10% awareness level. All right, so where can you learn more in terms of the federal, what the positioning was? This is the www.whitehouse.gov, and this website just has a lot of the overall. But what it also does, and I like this particular chart, it goes back in time to 2009, 2010, and each of these little blue things, you can click on it and it says what happened. If you notice, a lot has already gone into effect. Most people think it's starting now. The law was passed March 23rd, 2010. There's even benefits that that are happening. What's happening now is our mandate was started. And so in the past, here was our process, for the most part. You had coverage, you kept it, they told you what the rate increase was. And what did you do?
Paid it.
You paid it. This year, we have to become active participants, and the reason is there are new premiums, new subsidies, new programs, new penalties. And so for those people that just arbitrarily sign up again and take their whatever it is, it doesn't mean that they're necessarily doing the best thing for them. It might turn out to be, but we need to be a little bit more engaged this year. All right. So the law is 906 pages. The implementation of the law, I've been told, I haven't seen all of the rules and regs, but they've said basically if I stood here and lined up all the books, it would go out to there. And so I have a lot of work to do in the next, half an hour. But I've mastered breaking it down to the high-level pieces of what's in there and what you need to do. And we'll do it interspersed with little tricks. So you'll understand what the law is and then what you need to do. Okay, so you ready? Part one. The first place you need to go, www.accesshealthconnecticut.com. How many people have gone there so far? 1, 2, 3, 4. Okay, so, 15%. So, okay, good. October 1st, it opens. It's open now. You can go there, but the difference is on October 1st, you can actually start to enroll for health insurance. The insurance you can enroll for this year, October 1st through March 31st. If you enroll before the end of the year, your insurance will take effect January 1st. All right? And that's where you're going to go. The next thing I'm going to suggest that you do is when you go on this website, as much as you hate the junk email that comes in, I suggest you sign up and you can get the latest and greatest information. They actually will, tell you what's coming, what's happening, so that to me, this is not junk, especially because so many things are changing. It's just a wonderful way to get on their website. So for example, here's where I learned September 3rd, they put out a news release and the call center opened up. The call center is, they have 73 representatives, 40 in Connecticut, 30 in New York, so it's local. And they said you can call up and ask questions. Now understand, I've been speaking on this since March. Every time I would get, you'll ask me questions later, and if you stump me, I go and I get you the answer. So every time before September 3rd, if I got stumped, I really didn't know where to go. It was really, I mean, I would call people and try to figure out, but I didn't have the definitive answer. So here's the phone number, 1-855-805-HEALTH. And you know what happens? You can call this number, and a person picked up in a relatively short time, and I asked the Stump Randi questions. So I was not asking the easy ones. And the truth was, she wasn't sure of the answer. She kept me on hold, went to the manager, and came back with an answer. It's like, oh, this is going to work. This is easier for me. Here's what you need to know, though. When I called, before I got to the person, you have to put in, let me say it this way. They ask for your social security number and your birthday, and then the person picks up the phone. So since I see on your faces, like I already see it, you're going, I already see it. So I will share that I had a librarian that I said, you know what, I found that I asked them, do I have to give my social security number? And they said no. You know, so here's my point. If you want to ask a question, but it sometimes can be intimidating that you put in that social security number, you're going to go, they will still answer your questions. And I had someone in just this morning, she said, Randi, I did put in the social security number, they still answered my question. So if you have a question, do not let that request stop you from getting information. The other thing that they'll do is you can call in or you can email the question. And so I had a gentleman who was on Medicare. He wrote to me his question. It was 5 paragraphs. I was like, oh my goodness, what? Okay. But those, okay. And I understood what his question was, so I summarized it in one sentence. And I put out the question. The question was the Medicare question. If I have Part A and I don't have Part B, do I have to do anything? And the answer is no, you're fine. He wrote his 5-paragraph thing that was hard to figure out what the question really was. I got my answer in 4 hours. I will say that my answer came back quickly. His took about 2 days. It did take them a little while to sort through it, but the good news was he got the same answer that I got. So just and when you send them the email, they will say you have up to 5 business days to answer the question. But again, you know, I kept my question so they could get to it, and I got it in 4 hours.
Wait, I have a quick question.
Okay.
On that previous slide, how is the phone number?
Oh, it's you really only need the first 4 letters. Right, but it's just so you remember it. That's okay. So on the carriers on the exchange, there were 3 carriers that will be on the exchange: Anthem, Connecticut, and Healthy CT. Okay. There used to be, when I first started talking about this, there were like 9 carriers. Then in August there were 4 carriers. Now there were 3 carriers. So some people say, well, what if we end up with no carriers? No, these carriers are committed to providing the insurance. And if you go on the exchange, the only place you can get tax subsidies is on the exchange. Let's say you have a business, your business is providing your health insurance, and you want to see, you know, am I getting the best deal for my business, or should I get insurance through the exchange? But you then realize you don't qualify for subsidies. The same products that are on the exchange will be offered in the private marketplace at what I've been told is the same price. Here's what you just need to double check. If you're buying insurance on the exchange, you need to verify that your doctors, your specialists, and your drugs are also covered. Don't assume that, you know, well, it's, you know, don't assume I have Connecticut and it's the same, and, you know, do that extra level of questioning, because you might have different providers. So, how does the pricing work? Basically, when you go on the exchange, you're going to get 3 levels of pricing. They call them the Vitalis plan. There's the bronze plan, which says you pay out, the insurance company will pay 60%, you owe 40%. And then we have the gold plan, which says at 80, they pay 80, we pay 20. Which one costs more, bronze or gold? Which one would cost you more? The gold. Right, the gold is going to cost you more. And your out-of-pocket also varies. So if you stay in network and you're on a family plan with the bronze, it can be up to $12,000. And if you go out of network, it can be up to $25,000. So you can see the importance of making sure, does my coverage, is it there? This week on Tuesday, I was in Danbury speaking to small businesses. One of the people on the panel with me was from Danbury Hospital, and she was explaining on the Small Business Exchange, one of the main carriers still hadn't signed up with Danbury Hospital. Now that was on Tuesday. It could be that they signed yesterday, and I don't know that, but that's my message. We need to just double check. If you make between 133 and 250% of the federal poverty line, you will also be eligible for subsidies for these out-of-pocket costs. But now you're still saying, how much does my insurance cost? So, right, you're going, okay, so I can pick and I can sort of get some control over my premium because I can just take more risk and pay more out of pocket, but how much will it cost? Anyone want to know? Do you want to know how much it's going to cost? Yeah. All right, so I was so excited on, what day was this? August 5th. I kept saying there were no rates. No one had rates. August 5th, the newspaper came out, and it was sourced from Access Health Connecticut, and it said, how much would I pay annually? It's an eye chart. I'll walk you through it. And here's how it works. Each of the companies, Anthem, Healthy Connecticut, and Connecticut, have base rates for bronze, silver, and gold. And then what you do is you put in your county modifier. What county am I in? Hartford. This is Hartford. You guys are lucky. In Hartford, your modifier reduces the base rate. So whatever the base rate is, because you live in Hartford, it's lower, okay? And in some cases, you're looking about 15% lower. I live in Fairfield. You know what? It's higher. So, okay. And then, so you have to figure out your county modifier. And then what you have to do is you have to figure out your age modifier. So I was like, oh, this isn't that hard. And I put in my county modifier, I put in my age modifier, and boom comes the answer, $700. And I'm looking, how much would I pay annually? $700. I said, now this has to be wrong. Can't be. So I called up the reporter. I said, are you sure that it's $700? And he then said, let me call you back. He said, oh, these are monthly numbers. It's monthly. So I called up the state of Connecticut. And I said, you know that chart that's out there? It needs to be changed. I have not found another chart yet that's as clear as this, but just so you get a sense of pricing, a 21-year-old would pay $225 a month, and a 64-year-old will pay $675 a month. Now, here's the key thing. These rates do not include federal subsidies. So now you're going, okay, there's a way to figure this out. What's my subsidy and do I qualify? Okay, so how much will you pay? Here are the 3 questions you need to ask. Does your employer offer health insurance? And if the answer is no, we're going to continue on to see if you qualify. Do you get Medicare? If the answer is no, we're going to continue on. Now, to qualify for subsidies, it's income dependent. How much money do you think a single person can earn and still get a subsidy from the federal government?
The federal poverty guideline levels are pretty low.
So give it, if you think...
Well, I mean, I work for statewide legal services, and you know, you're looking at, it depends upon the formulas.
Right. But do you think it's 30,000?
No, it's not.
But do you think it's higher or lower?
It's lower. It's significantly lower.
Okay, so here,
But what you're talking about here is you're going to have a group of people that are middle income people that are not going to go into the federal poverty guideline levels.
So here's this. So this is going to be shocking for many people, and I think for you, you want to know what the number
I'm sitting here listening to this. Right. I'm unemployed. I'm going, there's no way in hell.
Wait. So here's the number. You can make, people don't know this, and this is to your her point as well.
Yeah.
You can make up to $45,960 and the government's going to subsidize your health insurance. Did you guys know that? Yeah,
Yes.
some of you do. So how much can a family of four make? You want me to tell you how much? So a family of four, 2 kids, 2 parents, the federal government's going to subsidize your insurance and you can make up to $94,200. And as I go around the state of Connecticut, you want to know something? Many people meet these kind of income requirements, and the statistic that I've heard is like it's like 70% of the people may get subsidies. So now your question is, okay, how do I find out if I can get a subsidy? So here's where you're going to go. You're going to go to Access Health Connecticut, and you can type in for if you're an individual or a family, and they also do this for small business owners. And they ask you some basic questions. What's your family income? How many adults? How many children? How old are you? And so what I did is I inputted, I said, okay, what if you make $94,000 a year, just under the 94.2, and you have 2 kids, and you're 50 years old? What is this going to cost? Here's what comes out. Basically, what comes out is that your premium, your health insurance. Oh, you know what? Can someone put in the power thing for the? Because we're gonna lose it. You just need the computer's on battery. And this happened to me when I did this. Okay. And once it goes down, it's a pain. Okay. So they say that the premium should be about $4,200 a month, and in this case, the government will give you a tax credit of $661. So you're going to pay $744. So here's the first thing that I went back and checked. I said, wait, but we have those 3 companies with the base rates, and then how close are those base rates to what's in here, right? Because that was important. So as the anal engineer that I am, you know what I did? I tested. And I said, how close were this? You know what? It was like within 10%. So if you want to get a sense tonight of how much you would pay and what you qualify from, it's pretty close. You can actually go on and you're going to get a sense of what the payment would be. Now, questions that I typically get. So it says tax credit. Does that mean I'm going to have to pay everything out in full, and then I'm going to do a W-2, and I'm going to get my money back from the insurance, and blah, blah, blah? And you know what? The way it works is you're going to pick your insurance, they're going to say the price, they're going to give you a bottom line figure, and you pay the bottom line figure. That's how it works. Now, I will tell you, because I went and got certified from the state so I could understand the exchange, just because I said I need to do that. There's 2 parts to the certification. The first part was the classroom part. The second part is the online part. They gave the training last week. I missed that one. So I only have now secondhand information. But here's what I'll tell you. Is this 15 minutes will save you 15%? If you're thinking you're going to be on this for 15 minutes and you're going to figure out your answers, the state has said, we expect that if you enroll online, plan on a 45 minutes of doing this, and if you're calling up, it should take 55 minutes. So, another thing I learned in GE, expectations. As long as I was managing expectations, I was surviving, right? So expectations are, is this going to take you an hour of time? Is this going to take, and I'm not saying that's bad, but I think it's important that we understand that. The other thing that I've been told is it's a lot of financial records that they go back through. So there will be no medical underwriting. They're not going to say, do you have an existing condition and what's your blood pressure and your BMI is too high? That's not what they're going to do. But they are going to go back and get tax returns, and I was told you're going to need to, this one I don't even have. Where's my marriage certificate? I don't know where that is. And then you're going to have to follow up with paperwork in a certain period of time. So again, to set expectations, it could be you're going to go on here and you're going to go, yay, I'm saving money, and many people come up to me and say that. They say, Randy, I did this, I'm going to save $100 a month. I had one woman, she was saving $350 a month. So she was all excited. But we need to understand, are we going to sit there and is it going to be cumbersome? I think it's the wrong word. Is it going to be involved? Most probably. Again, I haven't seen it, but everything that I've heard is we need to set expectations and that there is effort here. So for those of you that are going, I'm going to take the penalty. I'm not doing anything. And I have people that come up to me even afterwards and say, I'm taking the penalty. First thing I need to be really clear, if you don't have insurance and you end up in the hospital, my son was in the hospital for 15 days, not counting doctors, how much was the bill?
15 days?
15 days.
Let's see, I would say it was close to...
What did you say?
25,000.
Why was it 15 days?
So she had 76.
Yeah.
76 for 15 days. Got readmitted, it was another 76,000. So for those of you that are not taking insurance, that's a huge undertaking, a risk that you might have. If you have children under the age of 30, there are catastrophic plans available to the Invincibles, and they can get them. They'll have high deductibles, but they can get it. If you don't want to get insurance, you can pay the $95 penalty, or it's up to 1% of your income not to exceed $285 this year. But every year it keeps going up, and by 2016 it can be up to $2,000 in penalties. So just be aware that those are the penalties. Now, what are the penalties for the employers? And I will share with you that I have taken this data that explains penalties, and I've used my GE ways, because we only would get one chart to explain anything. And so there's a lot of words on that chart. It was a bad chart. I've gone through all the training with the lawyers. Here's the one chart. Okay. Penalties. And the reason I share this with you is as we go through and understand what the companies are thinking about, it's important to understand what their trade-offs are. How many people have heard about Walgreens? Okay, Walgreens just announced $130,000. They're going to give them money, and they can go on a private exchange and get insurance. So why would Walgreens, what happens? Here's how it works. The employer mandate says you will pay a penalty if either one of these conditions happen. If you do not provide coverage, there's a penalty. But if you provide coverage, let's say you are running, you own a doctor's practice and you say, I'm going to provide coverage. This side of the room, you're all doctors who are making a lot of money. And on this side of the room, you're not. You're the administrators and the lower level people. On this side of the room, everyone can afford your coverage. On this side of the room, it costs her 25%. It's unaffordable. So if you provide unaffordable coverage, right, and the test for unaffordable, let's now see if you got it, is what percent? 9.5%. Okay, or insufficient coverage. Insufficient means it doesn't meet the 60% actuary value. Got it? Okay, look, I can see you're getting this. You'll have to pay a penalty. So what's the penalty? Here's what you need to know. If you're a business between 0 and 50 full-time equivalents, do you ever have to pay a penalty? There are no penalties if you have less than 50 full-time equivalents. If you now are, you own restaurants, 3 Italian restaurants. They all have 10 people, 25 people, you're going, I'm in the clear. Because now the roll-up is to the one person who owns all 3. So just, again, this is not for businesses, but I just want you to be aware. If you have more than 50 employees, so you work for a large employer, and you decide not to offer insurance like Walgreens did, they have to write a check for $2,000 for every head minus the first 30. So it's costing them $2,000. The average in Connecticut, the average price of family insurance, do you know how much it costs for companies? $16,000. So think about what they're doing. So it's going to cost them $16,000. I had a woman in Westport, works for a firm. She's a pre-retiree. Every year the company got her insurance. This year she came to me and she said, I've been there 20 years. They're going to give me $8,000 and I have to go buy it myself. And the issue there is because they were paying a lot more, and so you can see how that's going. So you don't provide insurance, it's $2,000. Oh, minus the first 30. You do, like you did. You provided the insurance. You thought you were doing the right thing. You actually are doing the right thing. But she came and went online because you couldn't afford it, and you know what happens? And you got a subsidy on the exchange. For every person that happens to, you're going to pay a penalty of $3,000, not to exceed if you did nothing at all. So one of the math questions here is the business mandate was pushed off. Was it the individual mandate pushed off? No. Are we still going to get our subsidies? Yes. The business mandate, the number that I've heard is they estimate about $10 to $12 billion would have been coming in to the system. And so it's interesting. We're still going to get our subsidies, but you can see that, the math is not the way, we couldn't run my math in my home this way. But my message is, it's not going away. But I do want you to think about and understand, as we see the transitions, what the businesses are now thinking about and what the math is for them. All right. Okay. Ready for part 2? Are you ready? Because that was part 1, and there was a lot in there. And I happen to know there's a lot in there because I get reporters that come, and then they write everything down, and they put it in the paper the next day, and I go, I really say a lot. It's like, oh, and then they get it wrong. I know, and I don't blame. She says, I only got one thing wrong, and I was like, okay, so they correct it. But I know that I'm giving a lot of information. All right, what does it mean to me? So, the exchange. 3 companies lined up, okay? Here's what the Affordable Care Act says. Can they change the definition of what a deductible is or a copay? So now you're sitting there going, are these really apples and apples? No. The Affordable Care Act requires there was standardization of terms, and the disclosure forms are limited to 4 pages so that it's clear that we can make informed decisions. In terms of just some of the dollars, in terms of rates that changed, the limit on medical expenses not covered used to be at 7.5%. That's now gone up to 10%. Your cap on flexible spending is now at $2,500, and then high-income employees this year started to see Medicare taking out more money, up to 0.9%. So those are some of the math things. But what if you're sitting here going, all right, so how do I go about finding other insurance options? Where's the first place you should go? Access Health. Okay, the second place you should go is www.healthcare.gov. And what they do here, what this particular website does, okay, here it goes. Is it allows you, it goes state by state, you input your state, you can tell them a little bit what describes you. I have a family, I'm healthy, I'm pregnant, I have a disability, a little bit of background. You tell them how old you are, it answers a couple of other questions, and then you know what it does? It literally says, oh, here are some options. And it lays them out, and then you can actually learn more, and you click and you get more information. So my message here is there are ways that you're going to start to get more information that's easy to read. In this case, I would say they also did a good job just keeping it simple. Okay. Also in the Affordable Care Act, know that donut hole? If you're on Medicare, it goes away, 2020. It's gone. And you cannot here's a question that I get. My 24-year-old moved back in with us, and does his income now count towards our family income, right? And the answer is it depends on if you declare that person as a dependent or not on your tax return. And so this is another point. This year you have to start to say, wait, how much could he get for insurance on his own? And how much would it cost? And how much of a benefit am I getting as declaring him as a dependent? And there's some math here that you have to do. So that's an important piece to consider. So what do we need? So those are the rules, and we'll go through some more rules. But here's, remember, what do we need to do now? So you need to, so you have your health insurance, you have your subsidy, and you land in the hospital. You land in the hospital, and the nurse comes over, and she takes your blood pressure. She's taking your blood pressure. And then she comes over, and she wants to take your heart rate. You know what? It turns out 90,000 Americans die each year from infections in the hospital. Turns out, and I didn't understand until there, every time my son was walking around on the floor, they were like terrible. It was like, they were panicked, and I didn't understand this because I didn't know these statistics. How many people know someone who's gotten sick in the hospital? Okay, but do it higher because it's typically 50% of my audience. Okay, this is so. It turns out it's 1 out of every 136 people. All right. It also turns out that less than 50% of the time, this is a study done by Johns Hopkins, hand washing protocol is adhered to. Not because people are bad, not because they want to get you sick, not for any of those reasons. They're busy. And it actually also hurts. If you keep washing your hands, your skin, it hurts. It literally hurts. I spoke in New Haven, and I'll never forget this because the woman at the end, everyone, I take the questions, I'm answering the questions, and people felt relieved to have more information. And this nurse stands up at the end, and there were 70 people in the audience. And she said, you know what? I learned so much today. And Randy said, you need to ask, did you wash your hands? And she said, she's right. I'm the nurse. I'm at Yale. I'm not offended. I want to, sometimes I'm busy. And then she goes, she says, you know what else? You know that curtain we keep shutting in front of you? She goes, it's full of germs. So just know that part of what we need to do is get our insurance, but also we need to do some of this blocking and tackling. I'm going to share one other thing because we've talked so much about costs. This was a lesson that I learned with my son. So he had seizures or seizure-like episodes. We ended up with 5 emergency ambulance rides in 6 weeks. Okay, so he's seizing, you put him in the ambulance, they drive him to the ambulance, the first thing they do is they take a CAT scan. Well, it turns out now I've been to Norwalk, I've been to, and what we've also discovered is he would come out of these seizure-like episodes. So finally, he gets to, I think it was Norwalk Hospital, okay? He gets to Norwalk Hospital, we're going to take the CAT scan. I'm like, why? Like, well, can you explain to me why you're taking the CAT scan? And he says, we really can take an x-ray. And then he said to me, an x-ray, a CAT scan is like 100 or 1,000 x-rays. I've since studied that, did you know that if you have too many CAT scans and you're a young teenage boy, you could end up with a higher chance of lymphoma in 30 years? Here's my second piece of this lesson. What I learned was, ask why. And you know what happens when you ask why? Sometimes you get really comfortable with what they're saying and you go, okay. But if you say no, no, I don't want, they come up with plan B. So why do I share this story? I do this session, I did it in, I think it was in Fairfield. I did it a while back in Fairfield. This woman comes up to me, she came on Tuesday. On Thursday, she landed in the ER. And she said, Randy, I remember what you said. Ask why, say no. She had diverticulitis. She got in at noon. And by 8 o'clock at night, they were still like wanting to do stuff. And she was ready to go crazy. And they said, now you're going to stay for an hour and a half, and we're going to do a liquid drop of antibiotics. And she said, why? Well, blah, blah. They said, why? And she said, you know, I really don't want to stay another hour and a half. And the doctor said, well, we can give you the pill form, and sent her home. And so part of what, you know, as we look at, and I spend so much time, part of my message is explaining the law, but also as we look at costs, one of the things that I hope to do is empower all of us to have the confidence to ask questions and to see that, you know, an x-ray costs less than a CT scan. The pill costs less than the IV drop, okay? And I think, you know, that we can be proactive by sharing that information. All right. So, they're collecting all this data. What are they doing with all this data? Well, it turns out Medicare.gov has a site, and it's called Hospital Compare. Has anyone heard of this? Yeah, this is new. Okay, so this is so they collect the data, they put it in, and here's what you do at Medicare.gov, Hospital Compare. They say, what's your zip code? And you can pick 3 hospitals. And you know what it does? It tells you the results of the patient surveys, timely and effective care, readmissions, complications, and deaths. Ooh. Use of medical imaging, which is what I experienced with the CAT scan, and a couple of other things. And so you can input your hospitals, and what I did is I did it for patients who reported that their room and bathrooms were clean. So I just wanted to give you a sense. You know, we're talking about washing your hands, cleanliness is important. So in the state of, so the national average for answers to this is 73%. But would we want Connecticut to be better than the national average? Well, in Connecticut, we hit our averages at 71%. And for the local hospitals I put here, which was St. Vincent's, Bridgeport, and Norwalk, we're coming in lower than the national average. Now, what does this mean? Does this mean that if you're in a crisis situation, you got to, before you tell the ambulance which hospital to go to, you got to go look this stuff up? No. But you know what it means? It means that if you have some free time and you're just a little bit curious, like if you want, they have questions on here, your hospital room is noisy. You know, some of the hospitals are more noisy than the others. They have other questions. The doctor, discharge paperwork was clear to me, right? That's, you know, it's nice to know. And to me, what this represents is one of the first steps that they're moving towards transparency. In the same way, you didn't know about this site, you know, no one knows about it. But it's an example of taking that data and how it's being used. Okay. Oh, look at us. Okay. Whew. Here we go. Consumer rebates. In the law, it says that if your insurance company is spending money not on your premium, they're spending more than 20% on boondoggles and buildings, guess what? They need to give you reimbursement. You got a check. I every single time. Okay, raise your hand.
I was like so excited.
Oh, wait, I have like 3 checks. How was it this year? You got the check in August, right? Okay, how much was it for?
It was about that much, I think.
Was it? Okay, it might have been. So in 2012, it was about 160. This year, people have been telling me it's been about 75. How much was it?
I think it was about
75. It's going. So what the message here is, guess what? The number went down in 2013 because they're learning, and that is part of the law. You have to spend the premiums on care, or like in 2012, 137,000 people in Connecticut, and every time I do this, people say I got money back. The other thing is rate increases. If the rate increase is going to be greater than 10%, the state of Connecticut, the insurance commissioner has to review that and approve it. So one of the examples I have, I spent about a decade helping people with long-term care, and in long-term care, there have been rate increases. Genworth has had like a 40% rate increase, but MetLife went and asked for a rate increase and it wasn't approved. So, you know, someone says, oh, they rubber stamp everything, and I know on the long-term care insurance side of it, I can say they're not rubber stamping everything because it's not consistent. But just know that part of it is now they can't just come and say it's going up 25% and you're going up 15%. There is a process. And then the banning of lifetime limits. They can't say, you used up all your health insurance, you're done. No, there are no more lifetime limits. All right, so the other thing that's in here is how many people have had trouble with claims in the insurance company? Okay. Has anyone ever called the Office of the Healthcare Advocate? Ah, okay, this is the other thing to write down, because I would say every third time I do this, I get someone who says, I did this. The Office of the Healthcare Advocate, when you're being denied and they're giving you a hard time, you can call them up, and many times they will take on your claim. I had one woman that told the story. She said, Randy, the insurance company refused to pay. I called the Healthcare Advocate. They took on my situation. They went to court against the insurance company. The insurance company lost and appealed. The state of Connecticut went back and won again and got her the money. She said, I never on my own could have done this. And so I actually called the man who heads up this department, and he was thrilled. He said, you actually knew that's much, 6.3 million in 2012 that they got back for people. They said, yeah. I said, people need to know it. And I told them, many people will call. So if you need help, you're not alone. And we have a full department up there doing this. And then there are tax credits for small business owners. I do other sessions for small business owners, so I won't go through that. But I will tell you, if you go on Access Health Connecticut, you can also see small business tax credits and figure what those are out. All right, so other changes, it's just important if you get your insurance through your business. In the past, you had family rates. They weren't counting the children. This year, they're going to start counting the children. So it might mean that you might see this great product, but if they count the kids differently, you're going to end up paying more because you're paying for all your kids. My message is you go into work and you ask a couple of questions. Does this meet minimum essential benefits? How are they going to calculate the rates for my children this year, and how will that change next year? So that you need to make some informed choices to say, it might make sense for me to renew now, and then I'll have a little bit more time, but we need to be proactive, and that's my message. So, because you now know all of this, you guys have a plan. And because you have a plan, you can only change it if you have one. And I learned that when my family was in crisis. When you're in crisis is not the time to have options. And that's why I'm here, and this is why I do this, because I know each of you, I already know, tomorrow, sign up right on Access Health. I can tell. You guys are going to do it. You're going to start to be more proactive. And that was one of the secrets that Randy Kosh said. If you have a plan, you can modify it, and you have options. And so, my suggested action plan is, does it apply to me? If you're on Medicare, you don't need to do anything. For everyone else, figure out if you can renew, figure out how much it would cost for what you have this year versus next year, especially if you have children. Go to Access Health Connecticut, look at the opportunities that are there, figure out if you can have subsidies, figure out if you want those plans on a private exchange, and then make your choice, and you'll be prepared for the new year. So, my first question to you is, first step of any time, did you learn? How many people learned one thing? Did you learn one? Did anyone learn two? Did you learn two? Okay, no, because I came an hour. It's an hour and a half for me to get home tonight. I got two things. Okay, good. Okay, so you learned something. All right. Can you take action? Do you have a better sense of where to go and what websites to look at? All right. And you have choices. So, I do this, and I put in my book, it's my memoir, of the story I went through with my son. Today, my son, who has Crohn's disease and who is being advised to take all these medications that may increase his chance of lymphoma, was very scary. Do you know how my child manages his Crohn's disease? With food, 100% nutrition. We could go about that as a whole other thing.
Well,
But I will
we're
go
going to do
through,
that.
okay, well, we'll talk about it. So, and you know what I learned? I learned that I empowered my son to make choices, and I helped him, and I used a lot of the GE tricks. There was all these quality, you should have seen, it's all in the book. I'm probably the only person who wrote a book that the last chapter is about Six Sigma, and it's actually, well, it is interesting. But I used the management tricks of how do you motivate people, how do you help them. And what I found is when he was empowered, he's able to live a life on a nutritional system, and we've improved his outcomes. I reduced the number of x-rays that he took, right? And so that's my message. Tonight you understand where you're going to get insurance and how you're going to maybe save money and you're going to buy insurance. But we as a community can actually help the system improve by being a little bit more empowered. And so if you want to get in touch with me, just a couple of last things. I have a website, RandiRedmondOster.com, and on there you can send me emails, and I'm starting to learn that you do. I will share with you, I am going on vacation, and so, and I try to be really responsive, so if I don't, it's just because I'm going to take a little bit of a break. And you can read about my story, and tonight, before I take questions, the only thing I ask of you is, please give me feedback on how this went, and if you're interested, if you need help with health insurance or any of these other insurances, we have experts. I can help get you to some of the right places. And if you're interested in when my book comes out, just check it off and I'll put you on the mailing list. And so let me take some questions. Yes?
I just have, when you have to go to a broker, the reason I'm asking that is because I lost my job a year and a half ago, so I didn't have insurance. So I started shopping around for my own, and I went through a broker, and then I got denied because of some stupid pre-existing, it was minor.
Right.
But that was from the Aetna. And so he kind of dissed me, so I went shopping on my own, went through Connecticut,
Right.
got a plan with them. But now this guy called me out of the blue today, so what that rejected me through the Aetna. And he's all about getting, access help.
Okay, so the
Does he
answer is,
get money out of it?
okay, so the answer is you do not have to go to an insurance broker to get insurance and access help. There are assisters that can help you. If you do use an insurance agent, they can, like I know I went and I'm in the process of getting certified to sell insurance on the exchange. I'm not going to do that. I do the education piece. But from his perspective, yeah, he probably sees you as a client. But if you're not comfortable with him, what you just ran through, you do not have to use him. I will share with you that insurance brokers typically have an understanding of insurance, and that could be helpful. So, for example, here's the statistic. If you ask people, do you understand copay, deductible, and all these 4 basic terms, you know what % of Americans actually understand basic insurance terminology? 14%. It's okay. So in that case, you know what? Sometimes it's helpful to have an insurance broker. If you don't have one that you're comfortable with, check on health insurance, and we can help you in that.
But you can go and buy.
You don't need it. No, you
Okay.
don't have to have it. So, okay, next question. Go ahead.
I work for a large employer, and I'm just wondering, what is all of this? We have a benefits session, managers coming up
Right.
every October.
Okay.
So what could we expect to see that would be different for large employers that have always been providing?
So if you work for a large employer and they've always been applying insurance, the couple of questions that you could ask are, first of all, does this plan meet minimum essential benefits? Because if I enroll now, right, for the new plan, will that cost more because my old plan might have been skinny? So you need to understand, is this going to be a bump up in benefits? Or like with the library, it turns out they were already there. The other thing you need to ask is, if I have children, how will my children be counted if I, don't re-enroll now and I wait for the year? So in general, your insurance, your company's probably not going to change anything, but you do need to go through it. If it's costing you more than 9.5% of your income, then what you can do is go on the exchange and apply for subsidies. But I want to be clear, only if your employer is not giving you affordable coverage, can you go on the exchange and get subsidies. And so that's the 9.5, okay? Next question.
You had mentioned that buying on the exchange makes certain your doctors are covered. Is that similar to like preferred providers and so forth?
Yes, I want you, and it could be they are, you know, when the state of Connecticut talks about the coverage that they're providing on the exchange, the term they use is it's robust. That we have robust coverage, it's robust. And I just want to do a second, I'm just advising you double check. If you have a favorite specialist or a favorite doctor, don't assume that it's covered. And my understanding, and I haven't seen it yet, so, is that when you apply for the insurance, I'm not sure if it says it right on there. Like and that's only because I haven't seen it. So where part of my job is to educate you and to tell you the facts as I know them. The facts as I know them is that's to me still a gap of my knowledge. So because I'm here tonight and it's still, you know, we're learning, I just want to make sure that you all, you know, take an extra step.
So these websites don't necessarily have a list of the doctors that are...
Right, that's what I have not seen that yet.
You need to call your doctor and find out.
Right, and I understand. It could be in 2 days they have that. I haven't seen it today, and I just want us to double check, just to verify. Okay.
With respect to the caps on in-network and out-of-network,
Yeah.
if I max out the in-network out-of-pocket $6,000, does that $6,000 then carry over towards the, I think it was $12,000 out-of-network? Or am I at zero on out-of-network?
Okay, so if you cap out at in-network, I'm going to call that the stump, Randy. You know what, I'm not 100% sure. I understand. So if you hit, his question is, if you hit your in-network cap, are you capped out 100% of the others? I need to...
I think the out-of-network had a higher
right,
cap.
Right, but if you already
But I want to
hit it...
carry that, I'm wondering if I can carry that amount
Right, I
of
understand.
$6,000.
Right, you know, what I can say is ask, you can, you know, call Access Health,
Okay.
but I'm also, just because, you know, and I will say you're the first person to ask that, because if someone else had asked it, I would have had it. Okay, 6,000 to 12 posts, yeah. Okay.
I would say probably not, just based on.
Right, one of my jobs is that if I'm not sure, I'm gonna tell you I'm not sure, and, you know, and
But
that's
my
okay.
guess is,
Right.
it's 2 buckets.
Right, I don't know, so I'm gonna take that as a stop. Okay. Oh, you want to follow up?
One more question.
Okay.
With respect to the subsidy, if you're in the exchange on subsidy for, say, 6 months, and then you get a job, your income level goes up for employer insurance. When you go to file your income tax to determine the amount of subsidy you should have had, do they look at the tax year income or just the 6 months that you were in the exchange?
So my understanding is, and this, if your income changes afterwards, that there is a process that they can go back and reconsider, and that you then have to refund money. So that's my understanding as it is now. So some people can say, I applied, I was only making this, and I had this tax subsidy, and then they won the lottery. That there is a process that will give them the opportunity to go back. And my other understanding is and I haven't seen this yet, but I've heard it's 5 years of financial records that you'll be given. So the part of the reason that I don't have the answer, I know, so part of the reason I don't have the answer yet is that literally we're just being trained now and we haven't seen it. But this is, so when I talk about it's 45 minutes and there's quite a bit, there's no medical underwriting, but there is a comprehensive financial look to verify income, and I do understand that it can go back in time.
So that doesn't really help if you're out of work now.
So if you're out of work now, well, no, if you're out of work now, you're okay. Like, if you're out of work for the full year, you know, you're okay. If next year you get a job, well, then your financials will change. And what I guess the best advice is, look at where you are today, apply where you are today, and if you ended up working, that's a good thing, you know.
Yeah,
that's a good thing.
Yeah.
Right, should be our biggest problem, right? You know, right. So, okay.
Is it my understanding that the best of these programs is only going to be an 80-20 program?
So the question is, can you get more than an 80-20? And the answer is yes. There is a platinum plan that's a 90-10. However, in the state of Connecticut, on the exchange, the three companies that quoted pricing did not offer that level. In the private marketplace, those programs still exist, but on the exchange, the highest level is 80-20. Okay, go.
So what if you're low income receiving insurance through the state? How does this come into play? Because
So-
oftentimes you have to go for re-eligibility.
So is this, okay, so if you're, well, first of all, the income requirements for health insurance has changed and it has gone up. So it could be, when we talk about the 344,000, many, and 100,000 will stay on Medicaid, and some of those people will go over. It's because the income requirements have changed, and you need to go back and check your income and see if you still meet the income for your current program, or if you now will be able to go on the exchange and get significant subsidies. And so that's a homework that you just need to double check. Yes.
I guess my question has to do with how do you define income?
So I'm going to answer that question. They define income based on your W-2, the line item, modified adjusted gross income. So that's how they're doing it. It's modified adjusted gross
On
income.
the,
Huh?
on the, they actually take it off.
That's the number that I've been told that they're using. It's modified adjusted gross income. And as you go through this, you'll get more, but just in your own head, that's a significant number than what your total income is. All right.
Yeah. I'm an employee and my husband is assistant director, so he's self-employed. Currently we have an individual policy to Aetna, the $12,000 deductible between both of us. Are we considered family or individual on this Access Health Connecticut? When I go on to that, do we do individual or are we still family because it's my husband?
I would say family, but I'm also going to say you need to ask them, just double check. If you're married, you can submit a marriage certificate, you're a family. But if there's some reason why you think you might not be,
I just don't know which way to go.
Well,
Because that's like the first question. I'm like, I don't know, what am I?
So I would put in family. I would start, you're married, it's a family, right? So that would be my, but write to them, just say, I'm just double checking.
So it sounds to me like, because, all right, I have my clothes for many years, but with no flares, medicines, anything, I manage my own. However, the insurance companies will never forget that I had Crohn's 10 or 15 years
So
ago. So does it behoove me then to do this, or does it sound to me like I could possibly save money?
Okay, so the question is, if you have a pre-existing condition, in the past it was going to get very hard to get insurance. They will not be asking you those questions. They're going to ask you financial questions.
It's not hard to get it, the premiums just sky high.
There is they do not change premiums based on your medical history. Okay, so there's no medical underwriting.
Sounds good.
This is about March 31st, and I have a private plan. Let's say I renew that, and in a year, or whatever, I'm thinking, I don't like that, my private plan anymore, can I
Yes,
come to
but
this?
here's what you do. So the first year, the open enrollment will be from October 1st to March 31st. Next year, it's going to go back to the 3 months. I'm not exactly sure which 3 months it will be. So if that's what we want to do, which is I'm going to keep what I have this year, but maybe next year I want to switch. Pay attention to when the open enrollment is. Typically, it's in the fall, but just who knows? But,
What did you say, it was on YouTube, the last lecture?
yes,
On
just
YouTube?
on YouTube, and 40 minutes of, if you want to feel like, what do I have to do to live my life, right? And it literally helped me cope to find how I found lemonade from all of that insanity that I was going with. I didn't share with you, but my mother has lived with me for 15 years and is 85. So in the middle of everything, I also have elder care. And so, I look for anything for inspiration to keep me going. All right, I can take like 1 or 2 more, and how are we doing? So let me just ask this as a group. Was this helpful?
Yes.
Definitely helpful? Okay, so thank you. I really appreciate